All right, go on that side. Where's Jackie? Where's Jackie? She's coming. We have a very special guest here today, 5.5-month-old Jackie. Good morning, everyone. As you know, in February, President Obama sent Congress an urgent request for emergency resources to protect the American people against Zika. It is a growing public health emergency with almost 17,000 Americans, including nearly 1,600 pregnant women, already confirmed cases of Zika. The facts are these. The Department of Health and Human Services has already repurposed $670 million for Zika out of other critical initiatives to protect the American people. Secretary Burwell has said, we have exhausted our ability to even provide short-term financing to help with Zika. CDC is on pace to virtually exhaust all of the Zika domestic response funding by the end of September. CDC Director Tom Frieden has said, the cupboard is bare. Basically, we are out of money. We need Congress to act. As the Republican Congress returns from the longest summer recess in the modern era, we are joined by public health and disability experts to renew the call for immediate action for Zika. My colleagues and I are honored to be joined today by Dr. Georges Benjamin, American Public Health Association, Dr. Lamar Hasbrook, National Association of City and County Health Officials, Catherine Nees of Easter Seals, Emily Holobovich. Did I say it right, Jackie? Holobovich, and her beautiful daughter, Jackie. As we hear from our special guest, I want to say how proud I am to be joined by the ranking member on the Appropriations Committee, Congresswoman Nita Lowey of New York, ranking member of the subcommittee of HHS, Labor, Health, and Human Services, Congresswoman Rosa DeLauro of Connecticut, ranking member of her subcommittee, Congresswoman Debbie Wasserman Schultz of Florida, and the Congresswoman whose district has been most directly impacted so far, Congresswoman Frederica Wilson of Florida. With that, I'm pleased to yield to our distinguished ranking member on Appropriations, Congresswoman Nita Lowey, and thank her and my colleagues for their relentless, strong work on behalf of getting this funding for Zika and so many other issues. I yield to Congresswoman Lowey.
Thank you, Madam Leader, and thank you for bringing us all together. It is simply mind-boggling that we're standing here today, 7 months after President Obama requested emergency funding to the Zika virus, a public health emergency. The Republican majority has set records for their inaction and incompetence, but even by the low bar they have set, it is incredible that they cannot fulfill this basic responsibility of governing. The Republican majority has followed a predictable pattern in the Zika debate. First, oppose whatever the president requests. Second, take the request hostage and try to extract a ransom of divisive and ideological policy that the American people don't support. Finally, point the finger at anyone but themselves for their failure to act. The consequences of the majority's inaction have been severe. NIH and BARDA have virtually exhausted resources for critical vaccine development activities, and CDC has spent nearly all its funding for domestic response. The administration has been forced to raid other critical programs like child immunizations, fighting HIV, AIDS, cancer, heart disease to pay for these Zika efforts. Combined, NIH and BARDA need more than $500 million in FY 2017, on top of funds that have already been shifted from other health priorities to support Phase 2 clinical trials for Zika vaccine candidates and diagnostic test development. CDC desperately needs funds to help communities eradicate mosquitoes, educate residents, and study long-term health impacts of the Zika virus. Republicans Ted Yoho, Kurt Clausen, Mario Diaz-Balart, and several others have now told Speaker Ryan it's time to strip the political riders, do what it takes to pass the Zika funding. I would implore Speaker Ryan to listen to the Florida members in his own conference who are saying the time for political games is long last. And I'm very pleased to introduce Dr. Benjamin.
Thank you, Congresswoman. Good morning.
Good morning. Good morning.
I'm Dr. Georges Bidwin, and I'm the Executive Director at the American Public Health Association. As the head of the leading organization that speaks out for public health issues and policies backed by science, it's a no-brainer that I join you today. I'm also a physician, and I'm really here speaking to you and to the American people as a physician. You know, the science is clear. The threat is here, and lives are being impacted as we stand here today. This is no longer theoretical. We are in the middle of a public health disaster. More than 16,000 people have been infected with the Zika virus in the United States and its territories. That number, of course, is likely much higher, given that most infections are asymptomatic. 17 babies in the United States have been born with microcephaly, and many more are neurologically impacted. Now, tragically, one infant has already died. A public health emergency has been declared in Puerto Rico, where a fourth of the island is likely to become infected with the virus by the end of this year, including thousands of pregnant women. The Center for Disease Control and Prevention has issued the first ever domestic travel advisory warning pregnant women not to travel to areas of Florida where local transmission of Zika has already occurred. Now, we know that Zika poses grave health risks. Microcephaly, other major fetal birth defects, and Guillain-Barré syndrome are probably just the tip of the iceberg. But there is a lot we still need to learn about this serious threat. Since early this year, APHA has been calling for a comprehensive response that helps communities prepare for and mitigate local transmission of Zika. We urged a robust response that enhances laboratory and surveillance capacity, that contains Zika in areas where it is already present, and provides life-saving services, and I want to emphasize this word, life-saving services, for affected pregnant women and children. But our calls have gone unanswered by some in Congress. Instead, they've asked our public health officials to shift money from other public health priorities, putting others at risk from unrelated health threats, and propose policy barriers to getting the funding our people desperately need. Our nation's public health agencies are performing heroic work, and we applaud them for that. But the path some members of Congress have chosen is the wrong way to fight a serious epidemic. Listen, folks, it's not about politics. It's about public health. It's about public health. Give our public health professionals in communities around the country the tools and resources they need to do their jobs and protect our health. Congress must act by approving emergency funding for Zika now. I thank you, and I'd like to turn it over to Congresswoman DeLauro.
Thank you so much, Dr. Benjamin. I'm so delighted to be here with everyone. The Zika virus is one of the most critical issues that's facing the American people today. Yes, it is truly a public health emergency. The Speaker and the Republican majority have been irresponsible with the health and safety of life-saving of thousands of American families. They gavelled us into recess without sufficiently funding the Zika response, despite the mounting number of Zika cases around the country. Recess is now over. They can no longer hide in their districts. We are back, and the first order of business must be funding a robust response to the Zika virus. We are running out of time, as my colleagues have mentioned. End of the month for CDC and funding. NIH, by October 1st, Dr. Fauci said just this morning that they will not be able to move with clinical trials if there is no money by October 1st. What we need to do is to move for a whole year, not month to month. We need a robust funding for this effort. And in fact, between CDC and NIH, $670 million has been reprogrammed. That's vital resources from cancer research, from HIV, from mental health services, in effect, yes, robbing Peter to pay Paul. And just within the last few days, the Food and Drug Administration has called for all blood donations nationwide to be screened for the Zika virus. It is mandatory. And this is intensive blood testing is reserved for the most dangerous infectious diseases. Is this not a crisis? How are the screenings going to be paid for? There is no money for this at the moment. We've already programmed $44 million, reprogrammed it from the Public Health Emergency Fund. That's from state and local governments. Our state of Connecticut lost $490,000, and now how are we going to ask these local communities to pick up the cost for these efforts? Just one or 2 points. Americans are being told, avoid neighborhoods. They're cordoning off neighborhoods in our country for fear of infection. Women are being told not to get pregnant. The Wall Street Journal ran an article that said pregnant women are afraid to go outside. Some have decided to move, to go where maybe other families are so that they're not in any difficulty. A woman said, every time you go out of the house, it's like Russian roulette. I am really scared right now. A woman in Florida talked about going out in 90-degree weather with a hoodie and with long pants because of fear. And she said, all it takes is one mosquito bite to change the course of our entire lives. My God, who are we? And what we're about with this public health emergency in our nation. And we know what the effects are on a child and the effects of a family, a child who can't see or hear or who may, yes, die. Why? Why can't we fund what the president has asked for and attack this public health emergency? It gives me great pleasure now to introduce to you a woman who is head of the Easter Seals effort, and that's Katie Neese. Katie?
Thank you. Good morning, everyone. I'm Katie Neese, Executive Vice President for Public Affairs at Easter Seals. We're a nonpartisan organization dedicated to making profound positive differences in people's lives every day, from inclusive early education to physical rehabilitation and job training for people with disabilities. Easter Seals offers a wide range of services through a network of 75 affiliates serving 1.4 million people each year. The Zika virus is affecting the lives of children and adults all across the country and the world. The number of people testing positive for this virus continue to rise. And as of August of this year, there were 624 cases of pregnant women who have tested positive for Zika in the United States, and almost 1,000 pregnant women reported in the U.S. territories. The link between Zika and microcephaly in newborns is well documented. But the virus may also cause serious but less visible developmental delays that may not appear for years. Children with microcephaly will likely require comprehensive specialized services throughout their lives. As the nation's premier provider of services to young children with disabilities and their families, Easter Seals knows it's imperative to connect these families to developmental services as soon as possible. Early intervention can help a family gain the skills to help to care for their child, as well as to provide a child with the services like physical and speech therapy so he or she can reach important child development milestones and enter kindergarten ready for success. The Zika virus has also been linked to the significant increase in the prevalence of Guillain-Barré syndrome, also known as GBS. People who have GBS often are totally paralyzed for days, weeks, and many have lifelong disabilities. These individuals require long-term stays in hospital intensive care and months of rehabilitation. On September 1st, the World Health Organization reported that 18 countries and territories had reported an increase in the incidence of GBS or confirmation of a Zika virus infection among people diagnosed with GBS. With the United States in the midst of mosquito season nationwide, it's likely already too late to stop Zika gaining a foothold in some parts of the United States. And with hurricanes and tropical storms creating lakes of standing water and causing flooding across a number of states, the need for action to support individuals, families, and communities is now. There's a heavy human and economic toll to our country by not providing support or underfunding Zika activities such as prevention, diagnosis, and treatment. Along with a wide range of public health education health experts, governors and mayors and physicians, Easter Seals urges Congress to craft a Zika funding package that can be passed by the House and the Senate and signed by the President. Thank you. I'd like to now turn it over to Congresswoman Wasserman Schultz.
Thank you very much, Katie, and thanks to everyone for being here. For months, Congresswoman Lowey, DeLauro, and I, with every passing appropriations markup, introduced an amendment to appropriate the $1.9 billion in emergency supplemental funds that the President requested and that our public health officials unanimously agreed were absolutely essential. We said repeatedly that the Republicans, if they weren't going to step up and do what public health officials clearly said we needed to, that they were going to have to look mothers in the eye whose babies were born with birth defects that could have potentially and very likely been avoided. They were going to have to look the people that we represent in the eye and know that when they could have prevented locally born Zika from coming here, that it's on their shoulders and their head, that they didn't, because spitefully throwing an obstacle in the path of what President Obama was asking for was a higher priority than protecting the public health. I hosted events throughout this year, including very recently when the first cases of locally born Zika were announced in Miami Beach with Mayor Phil Levine, who is the mayor of Miami Beach, and many of the people that we represent have asked us, how are we going to protect ourselves? What are we going to do? When is Congress going to act? And sadly, due to House Republicans' inability and unwillingness to meaningfully address the Zika virus, I still can't tell them that help is on the way. Despite visits from congressional leadership, from the Surgeon General, from the CDC Director Tom Frieden, from public health experts who know best, saying this amount of funding was essential, that robbing Peter to pay Paul was unacceptable, they still dug their heels in, and we still have not acted. And even more troubling than Republican obstructionism, just last week we learned that for the first time, mosquitoes from an area of Miami Beach where there is increased trapping and control measures tested positive for the virus. So now we don't only have locally born Zika, we have identified mosquitoes that we know carry the virus. That startling development, coupled with the CDC's announcement that their vaccine research funds will run out at the end of this month, should bring House Republicans to the table immediately. To make matters worse, Republicans continue to play politics with this crisis by denying funding to Planned Parenthood for contraception for a virus that disproportionately impacts pregnant women. I mean, it is just mind-boggling. I can tell you that I personally know young women of childbearing age or women who are mothers of young children who decided not to come to Florida because of the risk of the Zika virus. I represent people, as does Congresswoman Wilson, who are living in fear every single day of mosquitoes, which, because we essentially live in former swampland, are everywhere and are unavoidable. This crisis is no longer on our doorstep. It is now in the homes of too many Floridians and Americans, and Republicans should finally join House Democrats in acting to combat it. And they should stop playing politics with public health and stop insisting that it is a higher priority to block women's access to health care than to make sure that we can protect millions of people from potentially risking their future children's lives to birth defects. Sadly, we have reached the I told you so moment. We need to act immediately to arrest this growing crisis. And it's my pleasure to introduce Dr. Hasbrook.
Thank you and good morning. I want to thank Leader Pelosi and the other champions that I'm proud to stand here with today. My name is Dr. Lamar Hasbrook. I'm an internist by training. I am a 25-plus year public health practitioner by trade, and one of the few that have led public health departments and efforts at the local, state, national, and global level. And so with that experience, I can tell you that currently as the executive director for NACCHO, representing the nation's nearly 3,000 local health departments, this is going to have to be a coordinated national response that starts with some federal resources and funding that makes its way to the states and to the locals. I cannot overemphasize the concept of localness because it is the local health departments that are in fact delegated the authority and responsibility to respond locally, like in Miami-Dade County. We are the ones that are on the front lines vaccinating for H1N1, quarantine power around Ebola, and now mosquito response and control for Zika. So the money and the resources have to make it to the local level where the rubber meets the road. I will also say that we have observed a decrease in funding over the last 5 years in particular. This funding has targeted public health preparedness, which includes mosquito control and abatement issues. This is a real big problem because more than half of the local health departments across our nation depend solely on this federal funding. No federal funding, no response. So that is very, very key. As has been mentioned, the CDC shift in funding from the Public Health Emergency Planning Fund has allowed for a temporary Band-Aid and some short-term relief, but we know by doing a national survey there are going to be long-term sequelae and negative impact of this shift of money. In fact, 1 and 2 health departments have expressed concern. A number of health departments have anticipated work layoffs as a result of this redistribution of funding. So we know that's going to be a real big problem. Lastly, let me say this. Without funding and restoration of the funding that has already been shifted, we are going to further compromise our local health departments, the frontline workers, from responding to this in a number of different ways. 1, we're going to have a limited capacity to support mosquito control and surveillance. 2, we're going to have the inability to send folks on site as they're doing door-to-door canvassing for certain neighborhoods and things. We won't have the manpower to do that, to actually even determine the presence of Zika local communities. As has been mentioned, the labs are overwhelmed, so we won't be able to actually monitor those folks that actually have Zika and those pregnancies to determine, monitor the care and the needs that are going to be needed for those individuals. And we're not going to be able to respond to future outbreaks because even though we have Zika, everything else is still happening in the world of local public health. So we still have flus and immunizations and all kind of other things. So we're shifting, but we still have the job to do. So in closing, let me say this. I can imagine few things more devastating than a pregnant woman after 9 months of labor to have a child that has microcephaly or some other negative outcome and have to live the rest of her life, and the family is family's life with dealing with that, which we estimate to be $500,000 to $1 million in care over a lifetime. This is a crisis. We're imploring Congress to move forward in allocating these funds so that we can protect our nation's communities. Thank you. And let me introduce Congresswoman Wilson.
Like everyone standing here, I'm calling on Speaker Ryan. I'm calling on him and each and every member of the House of Representatives to do our job. We had a long vacation. We're back now. My congressional district, Florida's 24th, which I proudly represent, is at the epicenter of the Zika epidemic in Florida. The district's Wynwood community was where they discovered the first local mosquito-borne transmission. A travel advisory has been put into place to warn pregnant women about coming to this American neighborhood, so no one comes. This is the first time in a long time that an American city has received a travel advisory. It is hurting businesses. It is a huge economic impact. And people are disturbed. Tourism is down. Restaurants are on the verge of closing, and the crowded tourist attractions are bare. This public health crisis has grown so serious that one of Florida's major newspapers, the Miami Herald, has created a daily tracker to monitor the virus spread across our state. So Miami is the epicenter. It has evolved into an open laboratory where the CDC is working closely with local health officials and county officials. For weeks, I have been speaking with a CDC response team that's been on the ground in Miami working to control, contain, and defeat the virus and to educate the community on mosquito control. But you know what? All of that requires adequate resources. Determining what works and what doesn't requires adequate resources. How long does the virus live in semen? How long does the virus live in blood? Should we stop blood donations in affected areas? So many questions, so many theories. We cannot afford to delay much needed scientific research, but that requires adequate research, adequate resources. From this Congress, our president has asked this. The CDC must be totally in sync with the appropriate technology, but they need adequate resources. They need resources to determine how to develop a test that is commercially available to the public and is easy to use. They need resources to develop a vaccine. They need resources to develop medication to stymie the virus. They need resources to determine how long it takes for a pregnant woman to get results from her Zika test. They need resources to determine how long a Zika virus lives in the body. The fever, the chills, the flu symptoms, we can deal with. But wake up, people. We're gambling with the developing brain of an unborn fetus. The bottom line is the threat of Zika is grave to pregnant women. There are so many unanswered questions that must be solved, and that requires adequate funding. Please, we need a clean Zika bill. No poison pills, no riders, just a bill addressing the Zika virus, a clean Zika bill that fully funds all aspects of the Zika virus. Many people who live in Florida are living in fear because there is so much to be learned about the virus. Congress, my colleagues, it is my state now, my beautiful state of Florida, and there are 27 of us serving in the House of Representatives. Many of us have taken votes to help you when your state needed help. I ask you today to help my state, my district. And please note, this epidemic has already begun to spread to other states. We cannot pretend it does not exist. Speaker Ryan, please bring a clean bill to the floor. The people of of America are depending on you. The unborn children of America are depending on you. Let's put our children's future first. Mosquitoes carrying Zika must be dealt with now, and that requires adequate resources. And now, Emily and Jackie.
Which is a good thing. It's a good thing. Oh, there she goes. I'm so humbled and honored to be here with these outstanding public health champions today. My name is Emily Halubowicz. In my professional life, I am the executive director of the Coalition for Health Funding. I have been a public health advocate for more than a decade. But today, I want to speak to you as a new first-time mom to baby Jacqueline, who thankfully was born healthy on St. Patrick's Day of this year. It was a long, hard, and expensive road for me and my husband to welcome her into the world. My pregnancy with Jackie was high risk because of my age and because of 3 unsuccessful rounds of IVF, including 2 miscarriages. As a high-risk patient, I visited my OBGYN once a week and a maternal fetal medicine specialist for monthly monitoring at first, and then weekly as I got closer to my due date. Both of my doctors had cleared me for a baby moon in January. My husband, Carl, and I had just checked into our hotel in the Bahamas when I got a panicked call from my parents. Cable news was reporting that the CDC had just issued a travel warning for pregnant women. There was a funny-sounding virus in mostly Brazil, but working its way up north, that they thought might cause birth defects. My parents insisted I get back on the plane and come home.
You were right.
We didn't know much about Zika virus at the time, but knowing what I know about vector-borne diseases like dengue, chikungunya, West Nile, I knew how to protect myself from mosquitoes. I promised my parents I would vigilantly cover up at dusk and dawn and make sure to wear bug spray. Had I known what I know now, I probably would have heeded their advice to cut our vacation short. You should always listen to your parents, Jackie. And as Congresswoman Wilson noted, much like HIV in the 1980s, in a lot of ways, we still don't know what we don't know about Zika. Anyone who has ever expected a child, high-risk pregnancy or otherwise, has ridden the emotional roller coaster of joy, excitement, anxiety, confusion, self-doubt, and outright terror at times. Am I eating the right foods? Am I gaining too much weight or not enough? Is that pain normal? Will my employer treat me differently afterwards? Where will I get childcare, and will I be able to afford it? Do I really need a diaper genie? Yes, you do, many of them, on every floor of your house. But no parent should ever have to wonder whether or not a chance encounter with a mosquito will alter the course of their unborn child's life. The difference between a healthy baby and a baby born with debilitating, irreversible, in many cases life-ending birth defects that are entirely preventable. For some perspective, Jackie was still in utero, and the Zika virus was still overseas when the government's public health experts first requested $1.9 billion in funding from Congress to stop the disease's spread. Jackie is now eating solids and days away from figuring out how to crawl. And Zika virus is here and spreading. As of last week, nearly 17,000 Zika cases have been reported across the states and territories, of which nearly 1,600 are pregnant women. Tragically, 17 babies have already been born with Zika-related birth defects that will cost an estimated $10 million per baby over the course of their short and painful lifespans, not to mention the personal and emotional hardship these families will endure. The government's role, first and foremost, is to defend us when we can't defend ourselves, whether those threats are terrorists or microbes. On the latter, our government has failed. As a public health advocate, I am discouraged and disheartened that the Zika virus hasn't been treated as the national emergency it is. As a new mother, I am outraged that Congress has spent more than 7 months wrangling over a funding request That is a fraction of what we spend on our military and just 0.1% of all the federal government spends each year. Put another way, we're talking about $6 per American. If you haven't already, I challenge everyone to Google microcephaly and take a look at the heart-wrenching images of babies born with abnormally small heads, and imagine that's your baby or your grandbaby. I cry every time I look and picture that being Jackie. I guarantee you and everyone you know would be glad for elected officials to spend just $6 of their hard-earned taxpayer money to make sure no baby and no other family has to live through that agony. Congress must act now to provide public health officials the resources they need, no strings attached, to ensure that not one more baby and family suffers from this debilitating birth defect. Thank you.
Thank you, Emily, and thank you, Jackie. How eloquent Jackie is, isn't she? Doesn't she deliver the message so well, accompanying Emily, her mom? Thank you all to our guests who are here and my colleagues for their leadership. Emily mentioned that we should Google what the consequences are. It could be of Zika. People have asked us, members have asked us, why don't you show the pictures? It's just too horrible. We could never subject families who are affected by having the world see the suffering that they are going through. It's just beyond disability. That would be almost a minor word compared to how transformative being infected by the Zika virus can be to a child. Anyone who knows me knows I'm a mother of 5, grandmother of 9. Children, I'm Italian American. We worship at the shrine of children, of babies. It's our lives. It's the center of our universe. And to have a public health emergency that takes its biggest toll on children challenges our conscience in a very different way. Dr. Benjamin said the science is clear, the urgency is here, we must act upon it, and Congress must act. Congresswoman Wasserman Schultz said, how can our colleagues look these families in the eye when they have been delinquent in delivering what is necessary to meet the challenge? I have another question for them, Congressman Wasserman Schultz. How can they look themselves in the eye? How can they look themselves in the eye when they have the power within their caucus to make a clean bill come to the floor? Instead, they are cannibalizing our budget for investments in how to meet other health needs and public health challenges that our country faces. So this is a disgrace. It's a shame. And we need to have a bill that is clean, that comes to the floor. And by clean, I mean no poison pills. There has to be a recognition, as Congresswoman Wilson has said, about how long does this live in the semen of a man, that this is sexually transmitted. I had a reporter say to me, it isn't sexually transmitted, it can be sexually transmitted. I'd like to know what the difference is in that reporter's mind. Oh, it can be? Then it is. And would you want to take that chance? So forget the politics, as has been said, as Kathy Neese said so beautifully. And wasn't it remarkable, the other consequences, lifetime, even unknown to us in the short term, the consequences of this? If it costs millions of dollars to support a child who has been so effective, only a couple hundred children affected offsets, the $1.2 billion offsets that cost. We don't want one child to be affected. We should feel guilty about every child that is affected. But the fact is, $1.9 billion is a small price to pay for the public health of our country and the individual well-being of these babies. So when it comes to babies, just consider some of us here lionesses. You heard our cubs. you're in big trouble. So when the speaker says, give me a break, is that what he said at his press conference? When you asked him, the press asked him, why haven't you passed the bill? Give me a break? No, let's give the babies a break, Mr. Speaker. Let's pass this bill. My colleagues would be pleased to take any questions you have.
Talking to people on the other side of the aisle, talking to people in the appropriations process, just in the past day that we've been back here, I've heard many say, well, we understand the urgent need, you guys want this bill passed yesterday, but it's probably going to take till the very end of the month or however long we're here to get this done.
Well, first of all, let me just say this is not a new issue. We had a steering and policy meeting in the spring on this subject. And Dr. Hasbrook, you would be pleased to know that the mayor of New Orleans was there and talked about the importance of recognizing the role of local government and states, et cetera, in addressing this. And Dr. Fauci talked to us about what could lie ahead months ago. And at that time, we were asking the Speaker for an emergency bill that could come to the floor in a matter of minutes. Emergency spending bill come to the floor then months ago. So now they said, oh, we're going to go through the regular appropriations process and we're going to do it that way. And when we even offered to compromise to agree to the Senate language, which was less than the administration needed and science demanded, they said no, even to our agreeing to that compromise. But the one thing he did say to me is, understand this, we are not going to have any funding for contraception in the bill on a sexually transmitted infection. Nita, did you want to speak to that?
I was just going to briefly say, before we break the break, after months of us requesting $1.9 billion, we had a conference committee. It lasted 2 minutes. The table was set, the chairs were there. We opened the conference committee and closed the conference committee. So the fact that they say this takes time, people are suffering. And if you don't care about public health, what about the economy of Florida? And it's why so many of, I think all the officials in Florida are calling this money. So I want to make it clear. We had a conference committee, Senate and House. We sat down, we greeted each other, and it was adjourned.
Well, it'll have to happen in 3 weeks. It has to happen in 3 weeks. And when it happens in 3 weeks, it has to be for a year. We can't in 3 weeks say, well, we're doing this until December. And when it happens in 3 weeks, it has to be for a year. Because if you're having serious scientific research, Dr. Benjamin will speak to that, you need to have lead time and guarantee that funding will be there beyond December. Dr.
Let me ask you, are you implying that the mosquito season will be over and not to worry about it? Well, I mean, but if someone...
They're talking about the legislative time that it's going to take in spite of all this. They're not even having a conference meeting about this until Friday.
Yeah, okay, well, this is not over. This is not over. Mosquito season doesn't end until later in this winter, and we'll see this again. I was a state health officer in Maryland doing West Nile virus. We know what's going to happen. We understand this pattern. We have seen this before. You know, New York, this year, Maryland, most of the East Coast the next year, and then across the whole United States in the third year. It's in Florida. We're going to see it. It's going to continue. So this idea that somehow there is some magic way for us to escape this, if that's what people are thinking, I don't know if that's what they're thinking, they're just wrong.
I remember when, during the appropriations process, when the three of us introduced an amendment, every markup, one of the criticisms of Hal Rogers and the Republicans was that, well, this is not going to even be funding that would be provided right away. Even if we put this funding in an appropriations bill, it won't happen until the end of the fiscal year. Well, we agree. That's why we should put an emergency supplemental bill on the floor today, and we could pass it. The Senate could pass it and send it to the President so we can make sure, one, that the vaccine research funding doesn't run out, that we don't slow it down, and that it doesn't get cut off, that we have vector and mosquito control that continues. Let's remember that, as Dr. Hasbrook just said, mosquitoes don't know the difference between District 23 and District 24. They don't know the difference between the boundary of the state of Florida and the state of Georgia or the state of Arizona. I mean, mosquitoes migrate. And eventually, this is going to spread as it spread, and as we predicted, and as public health officials predicted, would spread from the Americas to the United States, and it will spread across the country if we don't act quickly.
Yesterday's Speaker Ryan issued a statement saying that Democrats are playing politics and that he would block funding.
It's simply not true. First and foremost, I wish he were here and we could ask him together. Did I not agree that we would agree to the Senate language, which we thought fell short, but as a compromise we would go forward. And we would even cooperate on opioids because we did not want to support the opioids bill because it had no funding. But rather than make an issue of that, we said, let's just calm the waters, go for the Senate language, which has already passed the Senate. No. So that. But the fact is, as Chad was asking, okay, we have 3 weeks in September. Let's get this done now. But when we get it done now, it's not a 3-month to December. It's 1 year, because basic biomedical research that is necessary for the vaccine research, et cetera, requires some predictability and assurance that the resources will be there, and not to be held hostage to the ideology of the Republicans when it comes to the issue of contraception. I grant them their position on abortion and the rest of that, but contraception, really, do we need, I mean, we're talking about mosquitoes, but do we need to talk about the birds and the bees at the same time? Does anyone else have a question?
Yes. What's your read on the situation? Are you optimistic that this will ultimately be worked out? It might have to come to some sort of confrontation over the continuing resolution.
Well, I think that Lincoln said it best, public sentiment is everything. And I would hope that instead of just echoing the Republican line, I've heard so many in the press echo what the Republicans have said. The administration has not spent the money it has. It has. It has exhausted every resource. And as I say, cannibalizing very important research, biomedical research for cancer and other things, not to mention $500 million or more in terms of Ebola. So they have said the administration hasn't spent the money. They have. They have put this off for a half a year or more. We could have had an emergency bill long ago, maybe preventing some of the tragedies that have happened since then. But we do have to get this done in the next 3 weeks. And that isn't great, but it is what is available to us now. Rosa, did you have something you want to say on that?
I do, just to go back for a second to Chad. Let me give you a couple of examples. If all of a sudden we saw that there was a need for some national security emergency overseas, Middle East, Afghanistan, wherever, you pick your Syria, whatever it is. And our generals came and said that we need $1.9 billion. We need it immediately. It's emergency funding. It is about this nation's national security, protecting the mainland, protecting lives, protecting our troops. It not only would take less than 3 weeks, people would be stumbling over one another to get to the floor, to introduce it, to get it passed, to address an issue of national security. The generals, as Dr. Benjamin pointed out, the Faucis, the Friedens, the Osterholms, the people at Yale, the people at the Research Triangle, in research institutions all over this nation. These are the generals who have said, this is a national emergency. This will save lives. And these folks have said no. The Republicans have said no. Another very quick example, disaster relief. We cordon off disaster relief, hurricanes, floods, fires, and we say, you have a fund. You've got $6.7 billion. It's an emergency whenever it happens. You do not have to go through a regular budget process. Your money is there so it can move fast. 2 weeks, 3 weeks, whatever it is, to get it out to families to take care of themselves. Why is this not regarded as a public health emergency that doesn't have to go through a process to hold up money? Why are we not willing? Why are the Republicans not willing to save people's lives? This is what the emergency is.
Well, one of the reasons is that a budget should be a statement of values, and in a budget, this should be a very high priority for us. What is important to our country, the health and well-being of the American people, should be a top priority. Clearly, it is not. Tax breaks for the wealthiest people in our country are their first priority. Trickle it down, balance the budget by making these cuts, cannibalizing other scientific research. But let's put that aside for the moment. For the moment, we have an opportunity to come to the floor in a matter of days and weeks to pass legislation that will address the challenge, not fully, as the President and science has indicated necessary, but nonetheless address the challenge. It's very important that it be clean, that it be a full 12 years so that the science can, oh, excuse me, yes, thank you, Chad, 12 months so that science can work its way and so that we can, in conscience, address the needs of the American people, do the job they've sent. American people want Congress to do its job, and we want the Republicans to remove their ideological barrier to funding this Zika challenge. Thank you all very much. And let us thank our special guests for joining us, Emily, Dr. Benjamin, Dr. Holbrook. Katie, thank you. Because it was really stunning. Yeah,
so people know what the
We don't, just because a baby's born with microcephaly, we know that.